Women in Healthcare by Samantha Mitchell. Learning about Valerie. She's a 49-year-old woman. She's a white middle-class citizen. She was diagnosed with fibromyalgia at age 33. She has dealt with this issue for 16 years now. She was originally diagnosed by a neurologist in 2002. She went to see him because she was in constant pain. Eventually, she was hospitalized for it. She's a single mother to myself, 19, and my brother, 18. Having fibromyalgia has affected almost every aspect of Valerie's life. Physically, she's in pain always. When the pain gets bad, she can't function and it's exhausting for her. Emotionally, she has developed depression because she can't get out of bed. Most days, not being able to accomplish all she wanted to in life has caused her a lot of hardship. She is very frustrated because she can't do all the things she wants to do in life, like cleaning, shopping, and exercising. Valerie's support network for her health issue has changed over the years. She was married for years and her husband tried to be her support network but lacked compassion and empathy. Her parents have always been there for her to support her through her health issues. They help pay for her bills, attend doctor's appointments with her, and are there for her emotionally. She is also myself and my brother. Now that we're older, we understand more about the pain and obstacles she faces every day. Her therapist and psychiatrist also help her through a lot of her emotional issues that resulted from the illness. Her treatment in the past has been horrendous. Her doctors made errors on surgeries, she developed infections, and they've caused her to almost die. She's very satisfied with her current treatment by her doctor, Wendy Dyer. Wendy pays attention to all of her needs and makes sure she's taking care of herself. She runs tests and it has compassion for Valerie. She also sees a therapist and psychiatrist weekly for her emotional issues. She claimed that in her experience, being treated by a woman doctor was much better because she feels that women doctors pay more attention and have more empathy. She also claimed that they listen more and are willing to do more testing. In fact, as we learned in Chapter 3 of Lorber, many women do prefer to see women doctors because they run more tests and pay more attention to women's needs. Patients of women doctors were twice as likely to have a pap test and 40% more likely to have a mammogram. In another online article regarding women's health, it mentions that gender lowers women's social status and power, which can lead to vulnerability in healthcare. This means that many women can be vulnerable to being treated poorly due to their lack of social power. The obstacles that she's faced has been many. Depression has been a huge obstacle that Valerie has faced due to her fibromyalgia. She is working on this with therapy, medications, and talking through her issues. She has also had multiple other health issues to deal with while dealing with fibromyalgia. She's overcome these by continuing to focus on her health rather than unimportant things in life. She claimed it was hard to find someone that would take the time to go over all her health issues and treat her. But after looking thoroughly, she's found a great doctor. In an online article about functioning with fibromyalgia, it talks about how the illness can cause psychological stress that can involve a feeling of hopelessness or helplessness. It is difficult for many people to function and leads to a toll on their mental health. In the guest lecture by Dr. Jetty Harrison, it talks about the importance of mental health. Social factors like work, family, and commitments can cause a lot of stress. Women are more likely to have disorders like depression and anxiety. With an illness like fibromyalgia, women are even more likely to have these disorders. This is why it's so important to focus on mental health as well as physical health. Valerie is doing that every week by seeing a therapist and psychiatrist. How has her low income and gender affected her treatment? Well, she was unable to find a good psychiatrist to help her with the depression due to her low income. She couldn't find one because her insurance wouldn't cover anyone good. Many male doctors are also poorly treated her due to her gender. She wasn't taken serious and found that many men in healthcare didn't pay full attention to her issues. An ideal world. In Valerie's ideal world, doctors would address both physical symptoms and emotional symptoms. Fibromyalgia affects daily life, and with that can come many emotional issues. She believes that many women try to take on too much and forget to take care of themselves. What have I learned from this interview? I think the most important thing I've learned from this interview was that a serious health issue like fibromyalgia comes with a lot more than just physical pain. Emotional distress can cause more problems than physical stress sometimes. And I think that if male doctors paid more attention to women's needs and had more empathy, women would benefit more. After researching this topic and hearing all the issues my mom has dealt with, I would like to help women more when I become a doctor myself.